manager, services of our consultants, and our patients. Thank you. Our psychology team works with them to support them in the play. Again, we have a dance therapy hall. To take it up, COVID hit, and they've had some challenges. To just celebrate the Tufunguke initiative. Apologies. And junior psychiatrist. Your Excellency, welcome. This is how it is set out. Station. Then on the shared floors, we have a common area for our clients. This is part of the...
It's with pleasure that I join you in commemorating the 25th anniversary of Chirumo Hospital Group and to open the new mental health facility, the Bustani Level 5 Hospital. I'm very pleased to be here amongst people who have shown extraordinary commitment and provided invaluable contribution in accelerating interventions around mental health and mental wellness. I recognize the extraordinary talent and collaborative partnerships of consultants, advocates, ambassadors. Thank you for stepping up efforts to support people struggling with mental health and raising the focus on this issue. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, how we relate to others, and how we make life choices. It's very important at every stage of life, from childhood to adolescence through to adulthood. I congratulate the Chirumo Hospital community for your commitment, investment, and dedication to raise awareness on this very important issue. Your vision, tenacity, and impact of your work is evident from what I've witnessed in my tour of this facility. This purpose-built Level 5 facility has indeed set new standards of mental health service delivery for the region. I appreciate the fact that you have gathered all of us here, including those watching on TV, to advance the conversation on mental health and to hear from people who have shown extraordinary commitment and courage to address the issue. The chronic nature of mental health and the rapid increase in the numbers of individuals affected by mental illness has highlighted focus on mental wellness the world over, especially during these unprecedented COVID times. In the conversation today, we have learned some important facts about these illnesses that we probably didn't know 25 years ago when this institution first started. At that time, we did not have enough evidence to back up what we needed to know or how we should proceed with treatment for many of the problems we saw. But today, we know a lot more. We can now use this knowledge to implement better policies, implement better treatment modalities, and scale up interventions that will support a reliable mental care system. In this regard, the government has made significant strides through its collaborative work with the mental health community, supported by focus on this issue by His Excellency, the President, in promoting interventions around mental health through the Kenyan Mental Health Action Plan 2021. We have made progress in learning about mental disease in the last few years so that we understand them more scientifically. These include anxiety, personality disorders, mood and substance abuse disorders, trauma-related disorders such as post-traumatic stress disorder, and psychotic conditions such as schizophrenia. We now have a better idea of what to do about them. These gains have been impacted by the recent rapid increase, especially during COVID-19 pandemic, that has presented devastating impacts to many individuals, families, and communities. We know that the numbers are growing. We have witnessed unfortunate incidences of suicide, substance abuse, and addiction among some of the social challenges facing our society today. These are made worse by discrimination and isolation of people suffering from mental illness. We all know of or have heard of someone who has battled with mental illness. This is a signal to our nation that we must do whatever it takes to heighten our efforts to create awareness about mental illness. In many ways, despite our efforts, we lag behind in our mental health intervention efforts because we were not really dedicating enough resources towards the scientific research in this field, especially that of mental health for children and the warning signs from adolescents and young adults. I call on all of us here and around Kenya to make more of an effort to increase our understanding. Our focus, our obligation and responsibility must be to draw attention to things we have ignored in the past and to begin treating mental illness as an illness at a parity with other illnesses. It can be treated, and we know many who have recovered enough to lead a healthy life. Yet too many individuals are being left to deal with these issues on their own, and many face complicating life circumstances like drug and alcohol addiction, confinement, or abandonment. We must not accept this. We must do a better job. Access to quality mental health treatment, appropriate medical and psychological support where patients are treated with love and dignity is crucial to patient recovery. However, we cannot leave mental health care solutions to science and laboratories alone. We need to be aware of the cost of untreated mental illness, the loss of school days, loss of work days, dropout, marital distress, and also lost opportunity cost, the economic effects of individuals who are not functioning at full capacity. We must improve how we speak to our children about mental illness and talk specifically about their needs. I applaud the efforts of schools and community groups who have decided to join in and speak out. Our efforts are impeded by our own individual biases, myths, and beliefs, all perpetuated by ignorance and stigma. Our biases have not helped to encourage individuals seek treatment. In fact, these reactions silence patients suffering from mental illness from speaking out. It has demoralized families who have ultimately had to take care of their loved ones on their own. As individuals, parents, role models, let us ask ourselves what steps we can take to demystify mental illness. What must we do to guard against stigma and discrimination, which is deeply entrenched in our society? One of the ways we can change the misguided perceptions is through more public awareness. I know that heightened advocacy and awareness works through my own work in Beyond Zero by highlighting maternal and child health. We also have many great examples of how advocacy works through joint collaboration, through the media, with community support. Today, I commit to add my voice to raise awareness about mental health and to support the global collaborative campaign, Tufunguke, to encourage the voices that are silent to speak up and be heard. We can do this together. Thank you, and God bless you all.
I am delighted to join you today in celebrating the 25th anniversary of Chiromo Health Group. Through the story of Chiromo Health Group, I see a story of medical care in Nairobi County and in Kenya that has evolved from a small mental health facility to a modern, sophisticated health facilities that continue to offer dignified and quality health care, not only in Kenya, but in Africa, with highly qualified psychiatrists, psychologists, addiction counselors, occupational therapists, and nurses working together to promote all-round quality mental health care for patients in a dignified manner and environment. And congratulations, where we are sitting today, you can see what Chiromo Health Group of partners are doing. So I want to urge the management and mental health specialists in this hospital to offer mental health education and facilitation now more than ever because of the current COVID-19 pandemic, which continues to affect us in our homes and in our workplaces. Nairobi residents and Kenyans in general continue to suffer in silence because of the stigma around mental health. Your Excellency, the First Lady, I'm reassured with your presence here today to mark this special milestone achieved by Chiromo Hospital Group. It is a time we come out and speak freely about our mental illnesses and its effects in our husbands, our wives, our colleagues, our sons and daughters, and our colleagues. Let us all come together and fight this stigma and strive to prevent mental illness as well as manage it when it occurs, as we ensure our loved ones recover in dignity. Dozens of people with mental health conditions in Kenya are deprived of their human rights. They are not only discriminated against stigmatization and marginalization, but also subject to emotional and physical abuse in both mental health facilities in the community. In the past, poor quality care due to lack of qualified health professionals and dilapidated facilities led to further violations. I want to recognize the efforts of both the national and county governments in their efforts to ensure the mental health services are mainstreamed within the general health system and accessible within the communities. The domestic legislative framework needs to respect the inherent dignity of persons with mental disabilities, respect their legal capacity, including the right to free and informed consent to treatment, inclusion and decision-making processes, and public information campaigns. There is a need to ensure that when crisis events occur, part of the humanitarian response is appropriate and timely mental health support. To the group management and staff of Chiromo Hospital, you have a huge mission, a mission to ensure patients in your care continue to receive world-class medical care and high treatment standards maintained. Once again, congratulations on your successful journey for the past 25 years. I wish Chiromo Hospital Group specialty to continue its successful journey.
As it now, and through the leadership of the government, through the relevant regulatory authorities, we have the first level 5 mental health care facility in sub-Saharan Africa, Your Excellency. This branch hosts of 180 beds. And Your Excellency, I can assure you, every day we offer an average of 100, minimum of 100 inpatient care. Today, as we are standing here, we have at least 100 Kenyans and other members of this world receiving quality psychiatric care. This particular brand is key on partnerships. Our number one partner are our staff members. Today, we have 212 staff members who provide that dignified, quality mental health care. They are led by psychiatrists. The KMPDC chair, who licenses doctors like me, Your Excellency, will tell you that in that list today, licensed practicing psychiatrists are very few. Of the 55 million Kenyans that you lead, Your Excellency, there are about 75 actively practicing psychiatrists. That ratio, we are sure that working with the Ministry of Health will continue to enhance that number to provide dignified quality mental health care. Our 38 partner psychiatrists lead the teams in admitting and providing that quality care within our brand. We have 52 clinical psychologists. Clinical psychologists, Your Excellency, we know an individual goes out for 2 weeks HIV counseling training and they become psychologists. The following day, they put a big brand on the door, they are psychologists. No, here, Your Excellency, we have qualified clinical psychologists. These clinical psychologists working with other professional team members every day work to exceed the expectations of those who choose to walk through our doors. Mental health care. The World Health Organization says that it is the ability to give an individual optimal wellness, optimal opportunity to enjoy their life, to deliver in the economic development in the best way they can. Mental illness negates that. The space in which we operate, Your Excellency, is an emerging epidemic. The Global Mental Health Action Plan, the Kenya Health Policy, the Kenya Mental Health Action Plan 2021-2025 clearly highlights that this is an emerging epidemic. When COVID hit, the fragile gains, as I would call them, Your Excellency, in this field were either halted, disrupted, or totally disappeared. These gains on the mental health care landscape with the coming of COVID impaired access to quality mental health care. Many would not access quality mental health care that the actors were pushing towards the same. This brand, under the leadership of the presidential advisor and the other directors, worked with the government to position and continue to provide that care. 300 million people of the 7.9 billion people inhabiting Earth, 14% are estimated to have mental health care needs. The 1.1 billion people trickle down to Kenya. When the President, His Excellency, formed the task force on mental health to just understand the magnitude of this problem, we were honored that it was chaired by our chair. They said that 25% of those who seek outpatient care have mental health care needs. 40% of those who are admitted require mental health care needs. Are they aware? Are they receiving that care? No. Up to 75 to 80% are not aware that they have mental health care needs. It is an emerging epidemic. The resources that are dedicated for this emerging epidemic are not consistent with the magnitude of the problem. The World Health Assembly in 2018, October, 10th of October, provides a declaration and expands the NCD to the 5x5. The non-communicable diseases that were initially 4 were expanded to include mental and neurological diseases. So mental health, mental illness is one of the non-communicable diseases, Your Excellency. The progress we've made in cancer, diabetes, hypertension, chronic respiratory illnesses, is it the same pace at which mental health care is provided? There's a lag. And we are here in line with the global Sustainable Development Goals, saying that it is possible to provide dignified, quality mental health care. The resources, that there is need to escalate, mobilize and allocate more resources to this emerging epidemic. The resources have to be adequate, consistent with the magnitude of the problem. The resources have to be predictable, that it is not a hazard, that from the ministry, the relevant ministry, given that this is part of the tripod of the global agenda, it is predictably allocated. And it has to be sustained. So the resources that are channeled towards the mental health care space have to be within those domains. In Kenya, and we are very happy to report that this government has worked tirelessly to allocate increasing resources to the Ministry of Health. We are very happy about that. The Jubilee agenda was to allocate 12% of the budget to the Ministry of Health. 2 years ago, we hit 9.5%, just shy of the 12% that was set in the policy. We are working towards that as private healthcare practitioners, private healthcare actors. And Chiromo Hospital Group, leading in sub-Saharan Africa, that initiative is partnering very closely with the government to close that gap and provide dignified, quality mental health care. The NHIF, the private insurance companies that are here today, individual foundations, people who come out to just channel these resources are working actively towards enhancing the required need to provide the resources towards this emerging epidemic. Your Excellency, as an NCD, mental illness is preventable. The determinants, the socio-economic determinants, risk factors that predispose individuals developing mental illnesses can also be addressed at their root causes. And as Chiromo Hospital Group, we believe, in line with the WHO, that there is no health without mental health. That mental health comes first. And we will work with all the partners to be able to protect the mental wellness of Kenyans and beyond, to promote the mental wellness of Kenyans and beyond, and, if required, to provide the restorative mental health care services. That can only be possible with this collaborative team. Your Excellency, this is just but a representation of those who we work with in this space to provide that needed care. We have the insurance companies here, we have the government regulatory authorities, and many more working here. To change this narrative and work in line with the Mental Health Care Action Plan 2021-2025, leadership and governance, preventive promotive mental health care, access to quality mental health care, the infrastructural needs for mental health care will be done here. The leadership and governance, Your Excellency, we are highly humbled as the mental health care actors that you are leading us today. The whole world is watching. that the leadership is starting right at the top, adding your voice. The initiatives, Your Excellency, you've undertaken save lives. And we believe as mental health care actors today that your voice that you are adding to this space will save many more lives. It is my humble duty, Your Excellency, as we proceed with the program, that we will get to learn more, that this narrative can only be changed through lived experiences, as we invite many more to open up and not suffer in silence.
Pleasure to be here today and to congratulate Chiromo Hospital Group as they mark the 25th anniversary and the development of a modern mental health facility. This is a great milestone in the efforts of improving access towards mental health services in Kenya. Ladies and gentlemen, mental health conditions contribute to an enormous burden of disease, disability, and mortality. And I wish to share with you some statistics which demonstrate the mental health status in Kenya and globally, and the urgent need, therefore, to invest in this space. To begin with, the projected prevalence rate of mental health condition stands at 10 to 15% of the global population, and a vast majority suffer from depression. In other words, we are estimating that 350 million people are affected globally. And in Kenya, mental illnesses are a significant cause of ill health, with an estimated 25% of outpatients and up to 40% of inpatients health facility visits have diagnosable mental health conditions. And when we speak of 25% of outpatient visits, in Kenya every year we have 64 million visits to an outpatient center. So you can calculate 25% of that. That's a huge burden. The country has also witnessed an unprecedented rate of suicide, with an estimated age-standardized suicide mortality rate of 5.6 per 100,000. And I'm sure you all saw the story last week that was featuring about 468 cases of suicide in the last 3 months, compared to about 300 in 2019. And so these numbers are staggering, and therefore we need to do something about it. In terms of economics, when we measure the burden of this disease, we've come to learn that the global burden of disease, measured in terms of disability-adjusted life years, and 33% of years lived with disability are attributable to mental, neurological, and substance use disorders. And therefore, Your Excellency, ladies and gentlemen, despite the high disease burden due to mental health conditions, majority of people do not access services due to various reasons, including that these services are not available in their communities, that the services are not affordable, that we lack adequate resources and systems in terms of providing comprehensive quality care services, including also investing in human resources, medical products, and commodities. And so to address these challenges, we have to recognize the role of concerted efforts, and that is why we're here today, Your Excellency, partnering with the private sector, Chiromo Hospital Group, the regulator, the Ministry of Health, represented here by our Director of Mental Health Services, and NHIF. All these are partners coming together to ensure that we are able to provide this service. And in recognition of this, Your Excellency, allow me, to appreciate your efforts, particularly in the Beyond Zero campaign that you've really mounted and been a champion of. And perhaps this is a discussion that then Connie and I need to have when it comes to integrating mental health services in that service. We do know mothers, particularly post-delivery, do suffer from different kinds of mental health conditions and issues when it comes to depression and psychosis. And now that the Ministry of Health has put in place psychologists in all the 47 counties, then this is an initiative where we can actually integrate this service into the mobile clinics. And so this is something that we need to discuss, along with adolescent health and geriatric care. And so currently in Kenya, we are experiencing an increase in demand for mental health services. And the prevailing situation that has led to this demand is what we're doing here today, celebrating groups such as Chiromo, who've put in place resources, talent, expertise in raising public awareness, in reducing stigma when it comes to mental health diseases, and in ensuring that we're able to change the trends of mental health conditions. As a Ministry of Health, we do remain committed in implementing various policies and strategies to transform mental health services in Kenya. And to begin with, we do have the implementation of the task force report put together by His Excellency Uhuru Kenyatta. We do now have a mental health action plan, 2021 to 2025, and it highlights various priority pillars where we will be putting in place investments. And perhaps the one that excites us the most is that in the coming few months to years, we shall be moving Mathare Hospital from its location all the way down to Karen Gong area, in an area that's pristine, that allows for light, for green spaces, and for more recovery and, recovery in dignity. Perhaps we'll borrow your logo there, if you allow us. And really, this is a step towards increasing resourcing of the mental health space in Kenya. As I conclude my remarks, I wish to state that the public and private partnership in mental health will be a key driver to the achievement of the set targets in our plan to ensure that Kenyans achieve the highest attainable standards of mental health care. There are various opportunities and synergies that we need to explore, and we do celebrate the Chiromo Hospital Group for putting this in place and ensuring that recovery occurs in a space of dignity.
It's being presented to Her Excellency the First Lady. Can you all of you hold it to the cameras? 25th anniversary.
Kuna dhihirisha wazi nia yetu ya kufanya kila juhudi huku tukijiandaa kuchukua uongozi wa nchi hii mwaka ujao. Wakati kama huu tukijiandaa kuchukua uongozi wa Kenya bila kusita, bila kuogopa yeyote ila Mwenyezi Mungu, tuko tayari. ANC, Ford Kenya, mashinani walisema wewe ongea na rafiki yako Raila juu ya mambo haya. Tuliongea kama kuna tofauti kidogo kidogo. In fact, tulikuwa tumekubaliana na Mheshimiwa Raila tutafute an actuarial scientist, but we can cross check. That's not a big thing. I would strongly advise against an attempt as going to court. I've not spoken to Mheshimiwa Wetangula, lakini tukiwa hapa umefanya vizuri kuuliza hilo swali. Nimeona kwamba Ford Kenya vile vile wamepitisha azimio kutoka kwa NASA. Tuwapigie makofi. Becoming the fourth party. ANC walitoka, Wiper walitoka, ODM wenyewe walijiondoa, mashinani walitoka zamani. So hakuna NASA now. We are just going to formalize this whole thing. As I said, we have no problem. We are going to have to build already. We have taken the leadership. One Kenya Alliance. Oka tuko tayari kabisa. And we welcome every friend who wants to act in the best interest ya kuokoa nchi hii kutoka kwa wafisadi, ajiunge nasi. Including ODM, by the way. Yeah. Hii kitu inategemea ile maneno kusema ex gratia. I think I answered that. This thing was negotiated in accordance with the detailed guidelines which were signed by all of us, the principals, Mimi, Raila, Wetangula, Musalia, na Ruto. Detailed guidelines on power sharing out of the, because these are monies, taxpayers' money, from the consolidated fund. So that is history. And if there are even miscalculations, those ones can be gone into. I'm not interested in that. I don't want to be seen kwamba sisi tulikuwa tunafukuzana hatuna pesa. We have big ideas to deal with. Those are the things are small. Kwa hivyo picture, the main picture ni kuokoa Kenya hii. So we are not new to this country. What I have actually said, and I repeat, I am shocked that Kenyans wana tabia sasa to worship corruption. If we have to change this game completely. What is a Kiswahili word? No. Kuabudu fisadi. That is the word. Yaani unasikia Mkenya anasema my thief, my choice. Yaani unakubali mwizi tayari. Therefore, we can understand where they're coming from. Usiabudu ufisadi. Ufisadi ndio umefanya uchumi wa nchi hii to be on the knees. Kwa magoti. So we have to do something about it. But the main issue is we have to exorcise the ghost of corruption out of this country. And we are going to speak it from the mountain tops, from the rooftops, mpaka tuokoe nchi hii. Thank you so much. Nashukuru. Ukimpatia MCA sehemu yake ya mgao wake kutoka top huko hapa Kisauni ama ward hapa ya Nyali, hizo pesa zitasaidia in real terms kusaidia wale ambao wako mashinani. That is what we mean, bringing development chini pale. But everybody likes to talk about mama mboga which is okay. But mama mboga hataki kuibiwa. Alafu unamuunga unamuhonga na hiyo pesa umemuibia. Maajabu haya. This can only happen in this country. We were One Kenya Alliance, tukikutana Nairobi, tukasema Mheshimiwa Rais aondoe mambo haya, alegeze kama vile maajabu yamefanyika Uingereza. Prime Minister wa Uingereza alitoa uamuzi kwamba atafungua uchumi. Watu wakaenda kwa sherehe zao different places. Waingereza wanapenda sana kitu inaitwa pub, na badala ya corona infection kwenda juu hata imepotea hata zaidi. So wananchi sasa been socialized to the fact of wearing a mask, keeping your distance, and we are saying this thing is not going away soon. Hatuwezi kukaa huku watu wapore akili za wananchi na tabia ambazo ni mbaya za kujaribu kuelekeza ati mafikira juu ya bottom up, whatever you're calling it, na ufisadi na kuabudu wafisadi. Tukasema tutatoka. Ndio tumesema, in fact we had given end of this month, which is today, coming to August, which is tomorrow, serikali ichukue hatua hiyo. Tumeona of course infection rate imeenda juu at 13% according to yesterday's figures, but we are not scared of this. Corona itakwisha, na lazima ikiisha hivyo tuanze sasa kujipanga. Hatuwezi nchi kufungiwa, watu ndio hawana chakula nyumbani. Bring food on the table. Vijana hawana kazi. So we cannot continue that way. So we continue to call on that. Difficult as the situation is, we have to think out of this box. Think out of the box, ndio tuone vile tutasaidia wananchi wa Kenya hii kuimarisha hali yao ya kiuchumi. Na vile vile serikali ilikuwa imesema wataleta Johnson & Johnson. Kesho ni August. If we give every Kenyan, if we vaccinate 15 million Kenyans, corona itapotea.
Asante sana, Your Excellency, the Deputy President of the Republic of Kenya, Dr. William Ruto, the presiding bishop, AIC, the Archbishop, ABC, all the other bishops present, assistant bishops, viongozi wa tabaka mbalimbali, wakiwemo wa Machakos County, dada yetu Seneta Mudhama, dada yangu Mheshimiwa Mama County, Kamene, na viongozi wengine wote, Mheshimiwa Kawaya. Bwana Yesu asifiwe. Kwa majina, ninaitwa Soipan Tuya. Mimi ni Mama County wa Narok. Na niko na furaha sana kuwa hapa Machakos katika hafla hii nzuri ya kushuhudia kutawazwa kwa bishop pamoja na naibu wake na kuandamana na naibu wa rais, na nimefurahi kuwa hapa. Kiini ama original kanisa yangu ilikuwa AIC, na kidogo nilisikia bishop akisema kila wakati ministries zinakuwa formed lazima kuna mtu wa AIC pale ndani. Na akarudi akaongeza kusema pengine kuna vile watu wanapoteza njia kwa hiyo hafla ya kutawanyika. Kwa hivyo sitasema sana hapo. Ninaomba tu ili niwe bado niko kwa laini nzuri ya kwenda mbinguni. Na ninaomba niwe spiritually alert ndio nisipotee njia kama vile tumeambiwa. Na Mheshimiwa King'ang'i, hakuna shortcut ya kwenda mbinguni. Sisi wanasiasa njia ni moja. Bishop ama sijui kama iko shortcut tutaonyeshwa, lakini kidogo nafikiri hakuna shortcut. So mimi nampenda Yesu, nimeokoka na ninafurahi kuwa hapa. Na nimebarikiwa sana na neno kutoka kwa bishop ya kwamba tuwe spiritually alert. Na nikakumbushwa neno kutoka kitabu cha Luka mlango wa 12 mstari wa 48. Luke 12:48. Na the key message ni kwamba for all of us to whom much has been given, a lot is expected of us. And that is true of the church, and it's also true of the leadership that some of us are in. Na hapo ndio tunakutana katika kuelekeza wale watu ambao wako chini yetu. The much that the Bible is talking about, wewe umepewa neema ukakuwa bishop. Si ati wewe tu ndio ungekuwa bishop katika Machakos County ama katika Kenya. Mheshimiwa Naibu Rais, umepewa neema ukakuwa deputy president wa nchi hii. Mimi nikawa mbunge na wengine. Na kila mmoja wetu katika nafasi ambaye umejikuta, hata katika majumba zetu, tumeambiwa na bishop na ni ukweli, we have an element of leadership. And a lot will be expected from us. So ni lazima tujipange na tuwe tayari kuwajibika katika uongozi wa nchi yetu, katika uongozi wa nyanja mbalimbali ambazo tunajipata. Na bishop pia ametueleza tusifunge macho. Ukiangalia news na ukute yuko maneno ambayo inaendelea, unaanza kukemea TV. Kwa sababu wewe hutaki kuangalia mambo ya siasa. Ukiwa kanisa, tutapotea njia. The church must be alert to know what is happening, so that we can go back on our knees and pray for Kenya, so that we can be on track. So Mwenyezi Mungu awabariki. Na nafikiri mtanipa salamu ya kupeleka Narok. Nitawasalimia kule nikirudi. Nasikia bishop alikuwa Narok a few weeks ago, although it was on a sad note. Lakini sisi wote ni watu moja. Nikisimama hapa sina alama ya kuonyesha mimi ni Masai. Sinaweza qualify kuwa Kamene hapa. Ama so we pray for a united Kenya. We pray, we are going into 2022, and whether we like it or not, we have to talk about it. We have to pray about it, because if we don't take charge, then we will lose track. Tuiombe nchi yetu so that we can go in the right direction. So if you watch news and you see people talking about wanting to amend the Bible, you have to do something about it as a church. Because if we say we want to amend the Bible to badilishe itolewe sadaka, surely. And if you don't watch news, you will not know what is happening. Na mimi ni mdosi wa Kawaya huko bunge. Saa ingine mimi nakuwa speaker pale bungeni. So ukiona hapa ananikaribia huko bunge, hawezi nikaribia hivi. Anakaa square huko. So please let us be alert, so that when we see bad things happening, we take charge, we speak up, and we pray against it, ndio tupate line nzuri. Pongezi dada yangu Seneta Mudhama, unajua ulikuwa mtu wetu. Na tunaomba Mungu, utarudi nyumbani. We will pray and God will make a way. Mbarikiwe sana, asanteni.
Thank you, Soipang. Unajua, nataka tu usikie vile nasikianga ukinikalia ngumu mbunge. Ndio sababu naona na kuharas kidogo. But si ameongea mambo mazuri. I think she spoke very well. This time nataka nimuite Kamene. Kamene, karibu sana Mheshimiwa Kamene. Na Mheshimiwa Soipang, peleka salamu. Si tumetumana salamu kwa Masai. Yeye ndo makedhia monono imiani tumendete.
Walimu na civil servants wenye wanafanya kazi hapa. Hiyo ingine nile umesikia Deputy Speaker akisema. Gutire mwaka utathiraga murugara atakuthi maobicire maria manene gucutha sabo etagwatea DC mureterwe DC ya Matharaka. Sasa kama sie nuru kwenge mugacokia, hao wengine watakuja kufanya kazi gani yenye murugara hajafanya? Hakuna. Si hata ameleta speaker hapa. Nani mwingine amemleta? Kwa hivyo nikwambia anafanya kazi mzuri, na venye nilisikia kijana mmoja akisema mutikambiria kumumakira kegeranio warire ambiriria gucokia ciuria ena ithari ngiri mwe ithari ni mwaka ucio atigara wa 2021 kuthi 2022 mukimumakira kegeranio cia sio ni sawa. Na pili, venye umesikia mimi ni jirani yenu hapa Bere North, na speaker ni rafiki yangu, alikuwa mjumbe hapo mbele yangu, na huko tunajua ile kazi alitufanyia akiwa mjumbe. Na ndiposa tumesema hii Mount Kenya yote, Mount Kenya is the senior most politician, kwa sababu amekuwa kwa KANU, amekuwa organizing secretary, amekuwa magistrate. Kwa hivyo maneno ya kukagua makesi na nini, na ndio unaonanga hata bunge amekuwa speaker. Nataka tena ngero kitega speaker huko. Kama bora nile na ndu wengi. Na wao walikuwa wanashindana naye hata kupata kura 20. Kwa sababu wale wabunge walichaguliwa walikuja wakaona this is a man to be the speaker. Na tangu akuwe speaker hakuna mswada hata moja ya bunge ya serikali imaya kuanguka. Kwanza pigeni makofi yenu. Isipokuwa siku moja, na hiyo watu wa magazeti msiandike. Watu walitaka kutoa vita, hata wakamwagilia maji. Kwanza ni kujanenga kuna mundu na kakoroga kako kashuku. Ni vile nikakaa kwa mlango tu na ngojea mwingine, lakini hakuja line yangu. Lakini hiyo msiandike, tuliwaguzaguza kwa magoti na tangi mambio. Na wakati walipeleka hata hiyo maneno kwa bunge, amini kotini, koti ilienda ikasema speaker alikalia kiti vizuri, akauliza maswali vizuri, na hiyo misonda ikapita. Ile mnaisikianga misonda ya polisi na nini. So is a man that we are saying, na tunasema Tuni kithungu ngwenda kwaria no tondu kimbena kitharaka ititiganite ni turaugire tu ni turauga turi andu a Mount Kenya East Muturi anatosha. Muturi anatosha kuongoza hii Kenya yetu. Nyuma ugatea ni motore na muririkani watogu aliashwe ngemalia. Huyu ni jirani na akiwa jirani huyu Murugara hata sijui ni nini apatange bunge. Kama sasa Muturi anamsaidia kuwa bunge na Muturi akiwa president, ni nini mtakosa hapa Tharaka? Weke ndomo gatura. Umesikia hata in fact my friend senior principal, chief principal, tuma Murugara ICD hapa kuja leo Nairobi leo na uombe Muturi akuwe president upate hiyo waziri ya elimu. Kani hata otherwise speaker tumeambiwa na mheshimiwa wenye wameongea yururuka matura mama kitu kule mbele turakuvoera utimu thenya tutakuvoyagira na ni tukuvoya andu a Tharaka wanaoma oke makuvoere tembea Kenya mzima. You know the beauty, wacha niwaambieni, sijui kama niko na muda mwingi lakini wacha niseme honorable speaker was among the people, the experts wenye walitengeza hii katiba ya Kenya. Na juzi nilikuwa namuuliza, juzi tulikuwa naye pale 2 weeks ago. Akaulizwa na mtu mwingine, sasa ikifika mwezi ya 3 utalisaini? Akasema bana, as a speaker do not have to resign. And then come mwisho onete okenekera kabekere kau ndokalisaini tono no menya gore okenda gweka. Pia ni makofi ni mrefu sana. Kabla sijaketi chini. Sasa hii mnaweza inuka muandike. We have for a very, very long time associated with our brothers on the other side of the mountain. Na sasa hata wameweka mpaka wanajiita Mount Kenya West. Wakati wanapitianga hapo wakiomba sisi kura. And those young men here who gave the chronology of events since 1963. Wakiomba kura hii mlima inakuanga flat. Kuanzia Naivasha mpaka Isiolo inakuanga flat, lakini wakipata kiti mlima inapanda. Sasa hata wameanza kuipandisha tena wanajiita West. I'm just sending a message to them, a message of reconciliation. Niwaeleze tumewasupport miaka mingi. Sasa hii mwaka na warudishe warudishe nini? Tupe JBK. Ndio ndo Tharaka maugatea. Maugatea. Na shoka mbere ando mbere atea. Ni makethie. Na tukiuga ndo Tharaka maugire ni JB. Haya. Unajua tukikunywa chai Monday kama Tuesday pale bungeni wataniuliza uliona aje huko. Si tumesema turudishe Murugara? Haya, wenye watarudisha Murugara mkono juu nione. Murugara tosha. Mkono juu nione. Haya, hata wengine watamaka, hata mimi ni mamake yangu. Asanteni sana na Mungu awabariki. Thank you.
Asanteni. Makofi kwa Bwana Njagagwa. Ulingireni makofi sana. Mutori wetu wa mbere. Kana tibu. Wegani. Arambe tuerudha 30 minutes. In 30 minutes.
NASA ni historia. Haturudi huko tena. Tumemaliza. Mheshimiwa Goi ameeleza kinaganaga vizuizi na shida tulikuwa tukiona tukiwa katika NASA. Na sasa ni lazima tuangalie mbele. Ukitaka kuendesha gari, hauwezi kuendesha gari kila mara ukiangalia ile kioo ya kukuonyesha nyuma. Sasa ni lazima tuangalie mbele, tujipange. 2022 inakuja na mimi nawataka munisaidie nipate nafasi ya kuongoza taifa la Kenya kama rais wa Jamhuri ya Kenya. Tunataka wakati IBC itaanza kusajili afresh wale vijana ambao wamepata identity cards na viongozi wetu MPs, MCAs na wale wa administration na county government. Wakati Chebukati alikuwa akizungumza kule Nairobi kama mwezi mmoja iliyopita, alisema kwamba baada ya uchaguzi wa 2017 wameandikisha tu 140,000 new voters Kenya nzima. Lakini akasema msajili wa watu, yani yule anatoa IDs, tangu 2017 hadi sasa yeye ametoa additional identity cards milioni 5. 5 million additional identity cards. Kwa hivyo ikiwa mnataka tushinde, iwe jukumu letu kuanzia kwa wajumbe, kwa governors, kwa MCAs, tusukume kabisa watu wetu waende kuchukua identity cards, wale ambao walifanya registration lakini hawajaenda kuchukua, zichukuliwe mapema bila vizuizi. Wajipange wakati ile registration fresh ya IBC inakuja, kwa sababu kulingana na sheria watakuwa na about 3 new mass registrations of voters. Vijana wapya waende wachukue kujisajili kama wapigaji kura, kwa sababu tunahitaji hiyo kura. Na hiyo kura ndio itabadilisha mwenendo. Na kwa ANC sisi tunataka agenda number 1 iwe uchumi. Agenda number 2 uchumi. Agenda number 3 uchumi. Mimi ndio nilisema haya maneno. Sasa ukiangalia watu wa Tangatanga wanasema tutazungumza mambo ya uchumi. Ukiangalia ODM wanasema tutazungumza mambo ya ODM. Si ndio mimi nilianza haya maneno ya kusema shida kubwa ambayo itatukumba ni uchumi. Nikiwa kule Bomas nilisema Kenya ni nchi ya ajabu. Kenya ni nchi ambayo unaweza itisha mkutano wa hadhara pahali popote, hata katikati ya wiki, wachana na weekend, na utapata watu wamejaa, kwa sababu kuna uhaba wa kazi katika Kenya hii. Na haya yote ndio sisi tunataka tuzingatie. Mimi nataka nisimamie uchumi, tupanue huo uchumi, tupunguze ushuru. Tupunguze ushuru. Kwa sababu tusipofanya hivyo, watu watazidi kufinywa kulipa ushuru. Na mnafuata tu wale mpaka hakuna pesa mfukoni. Message yetu kama ANC ni uchumi bora na pesa mfukoni. Uchumi bora na pesa mfukoni. Isiwe tu uchumi bora kwa karatasi. Ukitaka kujua kama umekuwa bora, ni lazima uguze pesa mfukoni. Mama akiweka mkono kwa mfuko, apate pesa yake. Kijana akiweka mkono kwa mfuko, apate pesa yake. Ndio tujue sasa uchumi unafanya nini? Unaendelea, umeanza kubadilika. President ni president wa taifa la Kenya. Na ana haki kutembelea na kuzuru na kutazama na kukagua miradi yoyote katika taifa letu. Kile tunataka, na vile wajumbe wetu wamesema, wanataka awe na mawasiliano sawa na viongozi wa eneo hii, ili wakati wanatembea tutembee kama kitu kimoja, tukikagua hizo miradi.
Lonzo wakakaa chini wakasema, sisi tunaona dalili huyo mzee ilikuwa atupatie support Mheshimiwa Kinara Raila Amolo Odinga, lakini tayari anatangaza kuwania president 2022. Kwa hivyo mambo ya trust ikaingia ndani, hakuna uhaki hapo, na wakaamua badala ya kupigana na yeye, na kuleta kelele katika NASA, wao wajiondoe, watengeneze chama mpya. Hiyo ndio chama inaitwa One Kenya Alliance. Mbula borai. Numula wani Kenya Alliance mtawari ni kinde ngombe no ni kinde kuwa ni chama chetu no. Sasa sisi tulikuwa chama cha ANC kilikuwa chama cha kwanza kuitisha Amani National Governing Council kuratify decision ya kusema tunaondoka NASA. Na hiyo decision imepita hapo. Juzi chama cha Wiper kimepitisha tazama kinatoka kwa wapi? Kwa NASA. Na mkataba inasema vyama vitatu vikitoka katika NASA itakufa. Sasa tunangojea Ford Kenya kisema kesho ama kesho kutwa inatoka NASA itakuwa imefanya nini? Imekufa. Na tutoki NASA bure, tuko na mpango. Mheshimiwa Musalia Mudavadi, Mheshimiwa Wetangula, Mheshimiwa Gideon Moi, Mheshimiwa Kalonzo Musyoka wako katika One Kenya Alliance na wanaita viongozi wengine waingie ili twende tutengeneze serikali 2022.
Tunaona mambo ile inafanyika kwa area zingine, na sisi tunaona kama wakati imefika ile mambo inatakiwa yetu ya Western ya shida ama ya miradi ile tumefuata. Najua saa ingine watu wanaongea bila kujua. Rais atakuja hapa Western na ni hivi karibuni. Ako ng'ambo, lakini amesema Sunday akifika Jumanne anataka kukutana na wajumbe wa Western huko Nairobi. Friday anataka kukutana na wajumbe wa Western huko Nairobi. Alafu akuje hapa siku ya Jumapili. Jumatatu akue hapa Ikolomani. Akuje hapa Litambitsa ambayo iko kwa Kakamega County, lakini inashika pia na Vihiga. Anataka atuanzishie hapo gold refinery. Hiyo gold refinery si mradi imeanza saa hii. His Excellency Musalia Mudavadi huyu anajua. Tukiingia 2013 tulitembea na yeye. Hiyo ni mradi tumeuliza wakati huo, lakini ni kuchelewa, imechelewa. Tukarudi tena mara ya pili, rais akatuambia ataufanya. Ndio sasa anakuja kuanzisha na aende kule Vihiga pia aanzishe granite factory huko, na akuje hapa Kaimosi na aende huko Trans Nzoia. Hiyo ni safari ya kwanza. Ameenda hapa Nyanza karibu safari 9. Sisi tunaambia rais akuje tumpangie utaratibu ili akienda aende afunge tayari yake kama wiki 2, akuje akae hapa Western. Na pia wewe Mheshimiwa Musalia Mudavadi afunge tayari yake, tutembee hapa kwa Waluya, shida zile ameelezewa zile anaweza tatua, atutatulie. Na ingine itajengwa na serikali ile tunaomba hapo mbele. We want you to go on with that energy. Ongeza nguvu. Hata pale umekaribishwa Nyandarua, rudi tena na tena. Hawa Wakenya wanakumiss. Saa ile unapotea au uonekani kwao. Western, we can deal with it. Mimi, I'm asking you, please, don't rest even a minute. Endelea hivyo hivyo. Na siku ingine hawa watu wa makaseti waliniuliza, sijui yuko Jubilee. Yes, I'm a Jubilee member of parliament. Wakaniuliza unafikiriaje juu ya Musalia? Nikamwambia Musalia is our asset.